Hi, I am Dr. Mel B. Reyes, a resident of the Department of Obstetrics and Gynecology of the Eastern Visayas Regional Medical Center. Today, we will be discussing about gestational trophoblastic disease as an early pregnancy complication. What is gestational trophoblastic disease? It is the term used to encompass a group of tumors typified by abnormal trophoblast proliferation. In the Philippines, 2.4 out of 1,000 pregnant women experience having gestational trophoblastic disease. So, is it benign or malignant? Its benign form is the hyatidiform mole, which can be subdivided into complete or partial mole based on morphologic, cytogenic, and clinicopathologic features. Gestational trophoblastic neoplasia represents the malignant end of the gestational trophoblastic disease spectrum. This includes the more common types, the invasive mole and choriocarcinoma, and the rare types, the placentocyte and the epithelioid trophoblastic tumors. So what is hyatidiform mole or H-mole? It is an abnormal conception with excessive placental and little or no fetal development. Grossly, it resembles a bunch of grapes with or without fetal component. Histologically, it presents as a cystic swelling of the chorionic villi with variable trophoblastic proliferation. Normally, during fertilization, a single egg with 23 chromosomes fuses with a single sperm with 23 chromosomes, resulting in a new organism with 46 chromosomes. Smaller pregnancy results from errors in normal fertilization. The difference is that a complete mole appears when a chromosomally empty egg fuses with a normal sperm and the sperm genetic material duplicates to form a 46 chromosome organism. However, this organism doesn't have both maternal and paternal chromosomes. A complete mole most often have a diploid chromosomal composition, which results from androgenesis, meaning both sets of chromosomes are paternal in origin. The chromosomal pattern may be 46XX or 46XY due to fertilization by two sperms, hence the term diandric diploidy. An incomplete mole, on the other hand, appears when a normal egg is fertilized by two sperms, which forms an organism with 69 chromosomes that usually develops into non-viable fetal parts. Partial moles usually have a triploid karyotype like the 69XXX, hence the term diandric diploidy. These are each composed of two paternal haploid sets of chromosomes contributed by dispermy and one maternal haploid set. The maternal chromosome gives rise to the fetal component, and the paternal chromosome causes focal swelling of the placental villi. Risk factors for molar pregnancies include maternal age extremes with age-specific incident reports revealing a J-curve, an older paternal age of more than 45 years old, decreased dietary keratin and animal fat intake, and racial factors which includes Filipinos. Moreover, a history of a previous H-mole is a strong and well-established risk factor predisposing to another molar pregnancy. After the first H-mole, a second molar pregnancy occurs in 0.6 to 2.60% of pregnancies. Diagnosis starts with a high index of suspicion correlated by the patient's clinical presentation, supported by an elevated beta-HCG titer and by typical ultrasonographic findings. In majority of cases, the diagnosis is made in a patient presenting with amenorrhea, a positive pregnancy test, a uterine size more than the age of gestation, varying amounts of vaginal bleeding, and the absence of fetal heart tones. Other signs and symptoms may include hyperemesis, hyperthyroidism, preeclampsia, fecal lutein cyst, and respiratory insufficiency. Pelvic ultrasound is the most accurate non-invasive imaging modality for H-mole with an overall sensitivity of 50 to 86%. Complete moles are diagnosed more accurately with increasing gestational age. Approximately 80% are diagnosed during the second trimester when the great light or entropic villus change occurs, giving us the fluid-filled molar vesicles seen as multiple small anechoic spaces, the classic storm-like appearance. ultrasound diagnosis of partial H mole is less accurate and nearly 70% of cases will be missed. However, two sonographic findings are significantly associated with partial H moles. This includes focal cystic changes in the placenta and a ratio of the transverse to anteroposterior dimension of gestational sac of more than 1.5. Correlation of the ultrasonographic findings with beta-HCG levels can further improve the recognition of a molar pregnancy prior to surgical evacuation. Human chorionic gonadotropin is a hormone produced by the placenta after implantation. It is heterodimeric with an alpha subunit identical with the anterior pituitary hormones, luteinizing hormone, follicle-stimulating hormone, and thyroid-stimulating hormone. It also has a beta subunit which makes it unique. This table shows the expected beta-HCG levels in relation to the week of gestation. Complete H mole commonly have markedly elevated beta-HCG levels, with majority of patients presenting with a titer of more than 100,000 milli-international unit per milliliter. On the other hand, partial H mole less commonly present with markedly elevated beta-HCG values. Histological confirmation is mandatory for the diagnosis of hyatidiform mole. This table summarizes the difference between a partial mole and a complete mole from their karyotypes to their clinical presentation and to their pathology. Management starts with a diagnosed case of an H mole. Baseline laboratory examinations and imaging studies should be performed upon admission. Medical complications should be promptly recognized and treated. Surgical evacuation of molar products would then follow. Surgical evacuation of molar products is the definitive management of hyatidiform moles. It confirms pathologic diagnosis, relieves symptoms, prevents complications, and is the definitive therapy for most patients. Suction curettage is the preferred method regardless of the patient's age and uterine size. It is also for patients who are desirous of future pregnancy. On the other hand, hysterectomy is an option for patients with completed family size and for patients with life-threatening hemorrhage. It decreases the risk for local invasion. What are the indications for hysterectomy? The risk of malignancy after a complete mole is 15 to 25% and 0.5 to 4% after a partial mole. Patients with signs and symptoms of marked trophoblastic proliferation are at high risk for persistent disease. What are the indications for chemoprophylaxis? Chemoprophylaxis is useful in situations where patients are at high risk of post-molar GTD and when post-evacuation surveillance is doubtful. It may reduce the risk of progression to GTN. Who are at high risk for post-molar trophoblastic disease? Chemoprophylaxis is given as a single course of a single agent given to women at risk for developing gestational trophoblastic neoplasia. Methotrexate is the drug of choice which is administered intramuscularly. Actinomycin D may be given in the presence of hypersensitivity to methotrexate or liver toxicity. After molar evacuation, all patients must have serial beta-HCG monitoring to detect malignant degeneration. Serum beta-HCG level is measured 1 week after molar evacuation, then every 2 weeks until the level becomes normal. After 2 consecutive biweekly normal levels, it is done every month for 6 months. What are the criteria for post-molar trophoblastic neoplasia? First are plateauing beta-HCG levels for 4 consecutive weekly measurements over a period of at least 3 weeks, rising beta-HCG levels for 3 consecutive weekly measurements over a period of at least 2 weeks, and a histologic diagnosis of choriocarcinoma. It is important to use a reliable contraception during the entire follow-up period. Here are some tips for pregnancies after a molar pregnancy. Pregnancy may be allowed after 6 months of normal serum beta-HCG levels. For every succeeding pregnancy, an early ultrasound should be performed. For each succeeding pregnancy following a molar gestation, beta HCG should be monitored at 6 weeks postpartum. This is Romel B. Reyes, a resident of the Department of Obstetrics and Gynecology of the Eastern Visayas Regional Medical Center. Thank you for watching. I hope you learned something today.